Okay, it's 5 o'clock. I'd like to call the meeting to order of the Health and Human Services Board on May 15th at 5 p.m. at the St. Croix Government Center, room 1284. Roll call.
Lisa Lind,
Present.
Sean Anderson,
Present.
Kathy Leaf,
Present.
Dave Osnes,
Present.
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 Present. Present.
She's excused. There's minutes included in the packet for Wednesday, March 20th, 2024. Is there any additions, corrections? Hearing none, the minutes will stand approved as presented. Any public comment? Any public comment? No public comment. First item on the business items is election of Health and Human Services Board Chair. Currently, I'm not board chair, I guess, right? I'm convener. So, is there any nominations? Kathy?
I move to nominate you, Greg.
Okay. Any other nominations?
I move to nominate Supervisor Barkalow.
Any other nominations? Hearing none. Do we do a?
So, yep, so if anyone requests it, it can be done by a paper ballot,
Okay.
secret paper ballot.
Okay.
Yeah, let's do that.
Yeah,
Okay.
let's do paper ballot.
Yep, we will hand those out. Does everyone have a pen? Anyone need a pen?
There's a couple over here if you need one.
So you could either write down Mike Barkalow or Greg Telejohn. And if you misspell it, it doesn't count.
Oh, please, it's not like a write-in. Well, who do they go to, you?
Yep. The votes are being dutifully tallied by Colleen. Please stand by. Oh, she pulled one out of her sleeve.
I have 5 for Greg Telejohn and 3 for Barkalow. So Telejohn is the chair.
All right, very good.
Okay, thank you. Next item on the agenda is vice chair. Any nomination for vice chair? Lisa?
Supervisor Barkalow.
Is there any other nominations for vice chair? Any other nominations? I believe that's a unanimous ballot.
So what you do is you have someone make a motion to close nominations and cast unanimous ballot for Supervisor Barkalow.
I move to close nominations, cast unanimous vote.
I'll second.
Yes, unanimous.
Aye.
Say nay. Opposed, say aye. Oh, nay, okay. Welcome, Vice Chair. Oh. You think I'd know that by now? Push the button. Yeah, that's your responsibility.
Turn it on off.
Health, establish a meeting schedule for Health and Human Services Board. Is there any other preference besides the third Wednesday of the month?
At 5 p.m.
Pardon?
At 5 p.m. At 5 p.m.
At 5 p.m.? Is there any other preferences, or go?
I just want to state I'm good with it as is.
Okay. You don't, if there's no change, it'll just continue on with the current setup.
So there'd
But it
be
is
no ch-
something that you have the ability to, so we want to make sure that you
Yeah,
do if you wanted to change it.
okay. Well, meetings will stand as has been established. Health and Human Services monthly financials.
Thank you, Mr. Chair. Faye Strinky can't be here tonight, so I'm going to hit a few of the talking points that she and I talked about, and then if you have questions, hopefully Administrator Witt or myself can answer them. If we can't, I'll have to get back to you after Faye is back in the office tomorrow. If you look at page 11, yeah, there you are, at the overview, under the alcohol and drug abuse, or AODA revenue lines, you'll see that it's 46630, and then below that, the revenue was up substantially compared to the same time last year, which is good news. Revenues overall look pretty good so far this year. Staff development was up, and that's on page 12. Staff development was up. Some of that is due to trainings and workshops that staff attend that are grant funded, so the grant will reimburse for a good portion of those expenses. And purchase services, of course, as we talk about, continue to trend up, primarily in children's services and behavioral health and area of emergency detentions like at Winnebago. Some of the behavioral health purchase services include treatment costs that will be covered by the state opioid response grant. So about $17,000 to $20,000 of that so far will be covered through that grant and isn't tax levy. And let's see, birth to 3 expenses are running a little higher. That's driven in part by our need to contract for occupational therapy and physical therapy with outside vendors. These are mandated services that we have to cover if needed. So the thing that we've been kind of looking at is, would it make sense to try and hire maybe an occupational therapist to save the cost of contracting those out? But we're kind of right at the point where it doesn't make sense to do that yet, or we're not confident we would have the volume of revenue to support the position. So let's see. Faye mentioned that all revenues for 2023 have come in that she's aware of. They should mostly be in by now. And it put us at about $1.2 million over budget for 2023. Again, primarily due to those purchase service costs that kept rising with Winnebago and out-of-home placements for kids and on and on. And just 2 more things that I had, and then I'll see if you have any questions I can answer. ADRC catered food costs. I don't have the page that's on, I'm sorry. For unprepared food costs are down, and for catered meals are up. That's because we moved away from a kitchen model in the ADRC nutrition sites to catered food. So it makes sense that uncooked food or unprepared food costs would go down and catered food would go up. Kristen Newton and I are talking about ways in which we can manage those catered food expenses so that they don't get too out of hand. That's been a popular switch to catered meals, and it's become very popular with the senior population.
Bob, are those
Yes.
bid out?
The catered meals, yeah, they have contracts with, I won't name them all because I'll forget one. Yeah.
Oh,
There he goes.
Nothing, I was just.
cool. Okay, that's a competitive bid then, or every
Yeah,
year?
I don't know, Kristen, are those competitive bids?
Yeah, we go through our
Procurement
procurement process.
process, yes, they
Yeah,
are.
okay.
A guy, I know it's Agave Cafe, already Randy's place in New Hammond.
Yeah, Bonnie's Cafe and
Bonnie's
Glen
Cafe.
State. It's a little tricky because of location and geography and our meal times. We have to keep it specific to that location because of the time.
So the answer to the question is yes, they're up for bid. Yeah. And then the healthcare campus seems to be doing well overall. Census has been up, and one of the areas that's still a challenge is relying on contracted staff to fill vacancies and vacant shifts. That cost is higher than, say, if we had county staff in those positions. And we're still struggling a bit with recruiting, especially around CNA positions there. Nursing has been better in terms of recruitment, so making some progress in that area, but it's hard to find CNAs to fill some of those vacancies. Those are all the notes I had from my meeting with Faye, so I don't know if you have any questions like Ken or myself can answer.
Any questions? No? Okay. Thank you, Bob. Health and Human Services Board Public Health Responsibilities Presentation.
So, Mr. Chair, Ellie Clausen, our new Public Health Division Administrator and Health Officer, reminded me that our Public Health Division has to provide an annual orientation to the Health Board, local Health Board. So Ellie is going to do that for us tonight. Right, Ellie? Okay.
Good evening. Thanks for having me. You, as the board has not changed, you all hopefully potentially got an orientation recently, but this document is provided for you in your packet, and so it really has everything that falls under statute. So the legal requirements, not only of the Health and Human Services Board, but of public health. And so why we follow and why we do what we do, and why we need you guys to help us do what we do. So just briefly, as we move, care if I move? Thanks. As we move, oh gosh, it's touchy. Okay. So just the beginning there is just kind of the Board of Health basics. So Chapter 251.03 really outlines the Board of Health. What it does say is that it's not more than 9 members and that at least 3 are not elected. So thank you to our community members for joining, and that we do have an RN and physician, and that we reflect the diversity of the community. So all those are links. If you would like to read more, there is a lot of information about the Board of Health out there, as it is part of state statute. A little bit on the population served, so just as information that we use as data to inform what we do here for St. Croix County as a public health department, we use county health rankings, which is data gathered at a national level, then reported at a state and county level. The other piece we look at is limited income constrained and employed individuals, because St. Croix County on a social, kind of on the, in an asset ranking, St. Croix County ranks quite high, so it's really hard to look at kind of what populations might not have the same opportunities as others. And so we really look at homes that are asset limited, income constrained, but they are employed. So that is provided, that data is provided for us by St. Croix County, or St. Croix United Way. And then pieces about public health, which is there at 3 and is the arrow. Oh, the down, gotcha. Thanks, Clea. Yeah. So then the next section, as you may or may not be aware, but public health is a level 3 accredited health department, which means we have by state statutes different things that we must do. Actually, this summer we will be reaccredited by the 140. So state statute 140 basically says St. Croix Public Health, you have to do these things, or you will no longer fall under state statute, and we will then be given instructions on how to correct our actions. So there it outlines our requirements as a level 3, which also outlines kind of the requirements for myself in this position that I have to to be able to maintain a level 3 local health department. Our strategic plan is also linked there if you'd be interested. Our annual report is coming later today, so that's included in the packet. And then also state statute is required that we do a community health assessment and a community health improvement project. We are currently in a cycle of our community health improvement plan. But starting this summer, we are going to start the community health assessment, which will inform our 2026 cycle. So we really start way ahead of time. So our traditional path is to release a survey, and Public Health has retained an intern this year to help with that survey distribution. And then we do focus groups within communities, within stakeholders, to really try to get an idea of what it is in what should be included in our community health improvement plan that public health should really be working on and focusing on for improvement. So more to come on that. And lost my little down arrow. All right. Buzz through this. So there's a description of both of these. The descriptions are listed exactly out in state statute. Kind of what a community health assessment improvement plan should consist of. And then these last pieces are what is public health. So these are kind of our founding frameworks for what public health does. These are national-based frameworks. This isn't just something we created and said sounds good. And so then chronological events in Wisconsin's public health, what does public health do, how we staff, and ethical practices that we follow. The next piece there is you'll see all those Wisconsin public health statutes and administrative rules that we must follow as a public health department. And the last pieces are the local ordinances that actually exist that fall under our public health environmental health department. So we have an ordinance currently on food, lodging, and recreation, which basically means that we act as an agent for the Wisconsin Department of Agriculture, Trade, and Consumer Protections. Then we have one on human health hazards, and our last local ordinances is on tattooing and body piercing. So the kind of all the local ordinance fall under our environmental health section. And then public health resources. Wisconsin Association of Local Health Departments and Boards actually is made for you all. It is a resource made for Wisconsin local public health boards and then local health departments. So there are voting members there that kind of represent the information that comes to you as a local health board and has many resources. You can see the board members there. Wisconsin Counties Association, Department of Health Services, and then our kind of Wisconsin Environmental Health Association, WEHA. So all of these resources are just for your information, and a bunch of national public health organizations that we also align ourselves with. So any questions? Deb.
Do you know what our county health ranking is this year, or has it not come out yet?
This year has come out, and we have done very well. I don't know where we are ranked with all the counties.
Okay.
But this I have linked. Sorry, I have linked the most recent. I don't know. Can I open a link from here? Oh, perfect. So St. Croix County, exactly here for you. Here's our county snapshot. And here you can see way on the right, St. Croix County in terms of health outcomes. So this is kind of how long people live and how much physical, mental health people experience in the community. We are among the healthiest in the U.S. There we are in the green. So.
Says better than average. I think that should be our new motto.
I'm better than average.
But as you scroll down, you can see what is. As you scroll down, you can see the health factors, and so this is kind of primarily where we would focus as public health with our prevention or direct work. As you kind of, not the best at the scrolling right now, but go ahead and you can check out some of them, and then kind of that is all. This data will then inform our community health assessment and our community health improvement plan. So.
At this time of year with campsites open and so forth, are you more busy with inspecting campsites and licensing and and,
Yeah. Environmental health is incredibly busy right now.
yeah, and there's a lot of campsites in
There's a
St.
lot of
Croix
campsites.
County, actually.
Yes. So-
Public and government.
And we have added a new environmental health tech, which has greatly helped us in our ability to get all the inspections done and all the reapplications, so all the food trucks that are coming through and all the summer events, we have to inspect every single concert venue, all of those places, so, yes.
Yeah.
Thanks.
Thank you. Any other questions? Go ahead, Sean.
So the different level of health departments, what are the like advantages to being a higher level? I understand you have more like, I guess, ability to do more, but is there anything, I guess, less generic than what I'm saying?
Yeah, so with the level of health department, it sometimes is population-based, so it really looks at like, do you have a big enough population to support a health department that is able to do all of these environmental health licensings and inspections, or for some of our smaller counties that are neighboring, they instead have kind of a consortium in which they share those services, that they don't specifically do those services. It also depends on the number of public health nurses. Do you only have the capacity to do direct services, so like an immunization, or can you do prevention work where you would look at alcoholism, or even we have a nurse who looks at kind of all of our kind of child deaths and our kind of issues around there, and then is able to join committees and coalitions and work on prevention work. And so kind of more upstream than kind of direct service. And there's a whole listing of them. And kind of 140 will determine kind of, are we able to do these things? And so as we're able to do more things, then we would move up a level. And then there just is more requirements on me in terms of education and experience in order to be able to be the administrator for such a department. Did that answer it?
I think part of his question was, why do we want to be a level 3 instead of a level 2?
We would like to be a level 3 because then we have the capacity to do more. So we, in a sense of kind of looking at the number of people we have within our population, we wouldn't be able to provide the services we do, whether they be inspections from environmental health or nursing services, or even our reproductive health department. All of those services, they wouldn't be a part of what we did, and we wouldn't serve the community in that way if we weren't a level 3.
It's nice sometimes to keep those services locally. And we have, like if there is an issue with a restaurant or something that's, we know those people, we can work with them. It's better than probably the state coming in, so that's an advantage. And there's also an increase in funding with a higher level, but I mean, it's not a ton of money, but there's some increase in funding also.
Any other questions? Thank you very
All right.
much.
Thank you.
Next item is presentation of 2023 Health and Human Services Annual Report.
Thank you, Mr. Chair. I hope you've all had a chance to look through our annual report. I think it offers a nice overview of the many different services that we offer at HHS. I would say that it's hard to sort of capture the work we do in data and graphs and bullet points, but we did our best in this year's 2023's report to at least try and make it more personable. We included more photos of staff to show you who does the work, at least some of them, and we tried to tailor our bullet points to things that we thought the public and yourselves would want to know. The work is impactful, and it's challenging in ways that oftentimes a report can't convey. But we did our best with it, and I would like to, just as Ellie said, point out that public health is required to do an annual report. And so I just added that into this. So they had to do one anyway. It was very nice. I just added the whole thing in its entirety to the rest of the divisions. I just wanted to draw your attention to a few things. I won't go through the whole report, but I'll reference page numbers if they're correct. And hopefully you can go to where that page is. And I'll just start, if you don't mind, I'll just start with the financial overview. And I also invited division administrators or representatives of each division. So if you had specific questions about anything that they do, they'd be here to answer them, or available through Zoom to answer your questions. So if we get to that point where you have questions that are specific, they should be able to help you. So the HHS financial overview for 23 should reflect what you see in your monthly financial reports that Faye gives. It should be a match with those. The one thing that stood out to me I had to ask Faye about on the summary is if you look under the very bottom chart there, in Kitty Roads, in 2022, it was budgeted for $16,398, and it jumped up to $1 million. So that was because apparently we budgeted for positions that we hadn't filled in Kitty Roads for the 2023. We just took those positions out. We can still add them if we get to a place where we can hire, but that's why that number spiked up to $1 million. So it's just budgeted for positions that we didn't end up filling. Does that make sense? Okay. So I'll move through this, and then I promise I'll try and be as concise as I can and still do justice to the divisions that do this work. Page 47 is what I just talked about. Page 48. Where are you? Of the packet.
See, yeah, I don't have a packet.
Up there in the packet. Remember?
Are you talking about 48 on the screen or 48 in the
packet.
paper?
48 on the packet, not the agenda.
Page 6 on the packet.
What did I reference the wrong number?
No,
I didn't know what you were referencing, so I just started.
That happens a lot. All right, let's just start there. That looks good. All right. All right.
So we're there.
That's it, right there. Stop. That's good. All right. Department projects and milestones. So these are department-wide projects and milestones that I thought I would mention. We developed a strategic plan in 2023, a three-year strategic plan that lays out the framework for how we want to move forward as a department. I believe I made that available to you. It's not in this report, but in my opening comments on this, you can see the strategic directives that we landed on. We had help from University of Wisconsin Extension Office in facilitating those strategic planning events. Didn't cost us anything, and they did a professional job with us. So we developed our plan. We used that to guide our management meetings and guide our direction as we move forward. We also partnered with Western Wisconsin Health on a unique program to the state. It's called Recovery Support Solutions. We had $150,000 in ARPA funding to do something with around withdrawal management services. It's not very much money, so we tried to think of the most effective, cost-effective, and impactful way we could use that money. So we partnered with Western Wisconsin Health on an outpatient withdrawal management service called Recovery Support Solutions. This is a service that involves a physician overseeing withdrawal from a patient or a person that comes to them, overseeing the medications, overseeing their overall health, and there's a support team that includes clinical staff and peer recovery support specialists and case managers that help this person then get what they need for support beyond that intervention. They can also come back for weekly clinics with the physician and be seen for medication management and for overall health assessments. That program, again, is ARPA funded, so it's through the end of 2024. But we've seen it, the reason I mention this as a milestone is we had a slow start to this program, but with the closure of the hospital in Eau Claire and the detox center in Eau Claire, we saw a spike in referrals to this service. So we really got, I think, without knowing it, we really tapped into a need there that sort of just recently expanded. We also started Recovering Together cafes, also through ARPA funding in partnership with Family Resource Center. That's a monthly group that meets at the services center to talk. It's a curriculum-based a service that looks at recovery from really anything, mental health, addiction, eating disorders, things like that, and people that are interested in recovery who have young children. They can bring their children to get free child care and a free meal, some incentives, and hopefully it builds community investment in these kinds of recovery efforts. Those numbers for that group have been really surprisingly good, so we've had good attendance throughout the course of this. HHS also held its second annual mental health symposium in 2023. It was called Viewing Addiction Through a Different Lens, and had a pretty good turnout for that. It was held at Northwood Technical College. Had about 80, I think, people or so attend that in person, and then Adam has posted that on our website so people can watch that along with our most recent mental health symposium. That involved a partnership with Veteran Services, Justice Support Services, our medical examiner, and board members. Some of the challenges and opportunities, really, that we faced in 23 was a significant increase in adult protection and referrals in children and out-of-home placement, and costs associated with emergency medical placements at like Winnebago. Those costs really increased in 23. Some of that's, I think, a delayed effect from the pandemic. We start to see issues of isolation and loneliness, and those things, not just those things, but those things play out and manifest in the form of mental health, addiction, and other kinds of adult protection needs. Still having, in 23, we had a real struggle finding CNAs and nurses for the healthcare campus, and we had a hard time finding any substance use professionals for our behavioral health division. Some of that seems to be improving as we go. In fact, we're going to be fully staffed in our substance use division, hopefully at the end of the month. And we'll have 2 counselors. One will be named one is named Paradise, and one is named Sunshine. So how can you go wrong with that, right? We did transfer, in order to address the adult protective services needs, we transferred a position from our substance use service area to the adult protection services. We avoided having to ask for a new position. It's kind of a risk to take from one area and give to another, but the needs in APS were so great that we felt that we had to do that. And then our Children's Services Division engaged with the Judicial Engagement Team, which is an effort to look at system improvements within child welfare. Corporation Counsel's involved with that. A lot of other folks are involved with that. So that started in 23. Those are the department level overviews. If I could just point out a few things in other divisions, and I'll just open it up, see what questions you might have about anything.
Bob, with the closure of the 2 hospitals over in Chippewa and Eau Claire, what big challenges do we have with the county now regarding that?
Well, it removed a resource for us in terms of psychiatric care, occupational therapy, physical therapy, mental health therapy. It was the Ellie Phillips facility that closed was the only withdrawal management facility in this region of the state. So that went away, and that's when I say the other outpatient service we opened really picked up in referrals. That's part of the reason why there. But it just reduced our options for a lot of things that we do, and we had to look for alternative options. or come up with creative ideas for how to serve people differently. Yeah. Okay, if I could just go to page 49. Not 7. There we go. It is 7. Well, right. So I wanted to mention just our office support team, who are really the face of HHS to us. For anybody from the public that walks in or calls, they're oftentimes the first contact. They do an outstanding job, and they also support all of the divisions within HHS for various needs that they might have. We have Lisa, Laura, and Joe there, and then we have Claudia, who also speaks Spanish and does a lot of our translation and interpreting for us. And they really don't get enough credit for the work they do. It's complex, and you never know who's going to walk in the door with what they might need. So I wanted to give them a shout out in this. And on page 52, our records division work has increased, as you might expect, with increasing service demands. I won't get into all their responsibilities. I hope I do them some justice here. But the need for a records division can't be overstated. They have to monitor and maintain privacy laws with all of the different divisions. They have different privacy laws, sometimes HIPAA and 42 CFR Part 2 for addiction treatment. They have to do records requests, transcriptions, assist with audits, and many other duties. They keep very busy. We've got some good pictures of them here. They're kind of back in their own area in New Richmond. If you went there and did the tour, you can see they had a separate area that's secure, so people can't walk in and out. We control our records very carefully. It's an important part of what we do. And on page 56, the ADRC, I was going to talk about a little bit, just the fact that in 23 we saw significant service demands really in all areas of the ADRC. And you know this probably, but it's largely because we have an aging population. And again, with the some of the delayed results of the pandemic impacting that population, we saw a significant increase in financial exploitation, online scams, and phone scams with seniors. They're getting more sophisticated, and they're resulting in a lot of people losing a good portion of their savings. So they've been challenged with rising demand, with a stagnant funding base through the state. We just haven't seen an increase, I think I'm correct, Kristen, since 2008 in base funding for the ADRC. So it's really, Kristen Newton has to be very creative and thoughtful about how we can adjust to the needs of the population that's going to continue growing and serve them as well as we do, which is awesome. I think part of the thanks need to go to the volunteers. We had 201 volunteers in 2023 that saved the county about $365,000 by serving us in a volunteer capacity. Page 58, if I could move to behavioral health real quick. As I said, our adult protective service reports and requests increased by about 46% between 2019 and 2023, with cases of financial exploitation really skyrocketing by about 487% in that same time, roughly at the same time frame. Our costs related to Winnebago Mental Health Institute in 23 totaled over $1 million. We recaptured some of that through billing third parties, but it ended up with a net cost of about $700,000 to taxpayers for these placements. Winnebago, if I'm correct, the cost is about $1,400 a day. So when we talk about alternatives to people going to hospitals and saving money through serving them locally, that's the reason why we're trying to do it, on top of providing hopefully better care in a local environment so they don't have to be transported so far. Law enforcement also spends a lot of time and money transporting people. It takes away from their ability to do other things. Children's services in 23 on page 63 also saw increases in youth justice referrals and child protection reports, and youth served in our children's long-term care, or children's long-term support funding, CLTS services. increased caseloads in multiple areas of children's services with a perceived increase in complexity of cases. It's hard to measure that, but it seems to be true across the state. Just kids and families with these multiple dimensions of need that aren't easily solved. And Corporation Counsel has been a big part of certainly helping us with many of those. And we did transition our child protection cases to Corporation Counsel. And the last thing I was going to mention, which was great, and the last thing I was going to mention was we received a relative caregiver grant through Children's Services. And we continue to try and recruit and retain foster parents. We had an event earlier this year. I'm forgetting the date. On page 67 in CCS, or Comprehensive Community Services, it's a big division, Medicaid funded, and they received 156 referrals in 2023 with an average monthly enrollment of 143 people, 43 program graduations. This area of behavioral health, I think, is really, it's a glimpse to the future of behavioral health in a way of looking at alternative ways to work with people with mental health and addiction needs with outside the realm, sometimes including the realm of traditional treatment. But it's looking at other ways in which to engage people in healthy or therapeutic activities that help them recover, both children and adults, from various kinds of mental health needs and substance use or addiction needs. It's grown. I think we had the pandemic after I started here, and Becky started about the same time, Becky Kerr. So we had a lull there in admissions and referrals for a while, but as the pandemic, I won't say came to a close, but as it became less of an issue, we saw referrals increase, and right now I think we're doing very well in that division. Again, it's Medicaid reimbursed, so you have to have Medicaid in order to participate in it. Page 69, targeted case, I just wanted to mention targeted case management and community support programs, or the community support program, are also housed under the CCS division. So Becky has oversight of those two areas. I don't have too much more, so just bear with me a little longer. I wanted to focus on economic support a little bit. If you remember, there was a federal public health emergency in place for, well, Rhonda, you might have to help me. I think it was almost 2 years, though. Just nod. Close. Somewhere in that time frame, though. And during that federal public health emergency, people receiving health care and food share benefits couldn't be removed from those benefits. Once that federal public health emergency ended, our Economic Support Division and the Great Rivers Consortium had to go through all current beneficiaries of health and food share benefits and reassess them for to determine if they qualified for benefits or not. It's called the unwinding that you probably heard about, and it involved a tremendous amount of work. It's only one area that they did a tremendous amount of work in, but I thought you might remember that from previous discussions. In the packet, there's a pie graph that shows that pie chart that shows child care spending or child care benefits and food share benefits. It doesn't show medical expenses or medical benefits. What do I want to say? Medical care spending, medical care spending from benefits received, because we didn't have the data to put in there. I just wanted to mention that last year in 2022's annual report, the amount was over $1 million that people spend at healthcare facilities or on other kinds of healthcare needs based on the benefits that they receive, that they're qualified to receive. So in that pie chart, we'll have to fix the pie chart. We'll have to fix the chart once we have that data. And then applications for food share and medical assistance increased, as did calls received by the Great Rivers Consortium, while 99.4% of applications were processed timely, which is pretty remarkable, I think. On page 75, the healthcare campus saw increased admissions with an average census of 32 in skilled nursing and an average census of 37 in Orchard View. There were workforce challenges, as I already talked about, but overall, they've, through a higher census and some Medicaid rates that went up, were able to come out of 2023 financially in pretty good shape. So didn't require any tax levy funding for the healthcare campus. Let's see, we did have to rely, as I said, on contracted staff to fill shifts, which was expensive. And then I just wanted to touch on public health real quick, and I think that's about it for me until you have questions. The Public Health Annual Report does a nice job, I think, of outlining the framework and strategic goals, as Ellie pointed out, and objectives in each area. There's a section of the report, I think it's on page 93 of the packet. It kind of provides an example of how public health often impacts the daily life of St. Croix County residents. I thought it was a nice way to show in plain language kind of how they impact people in various ways, that day in the life thing, or everyday life. And also, and I also wanted, for the healthcare campus, I forgot that our Employee of the Year for St. Croix County came from the healthcare campus. Yeah, could you? I didn't put it in, because Ken's picture's there. There we go. So Maria Zelinsky and Ken are photoed there. Okay. And the last thing I was going to mention for the report was for public health, Sharon Razor was named the 2023 Friend of Public Health. And Sharon worked for public health for 30 years as a nurse and supervisor. And since her retirement, she's provided a lot of support to the community garden. The community garden's right next to the services center, if you haven't seen it, and which provides fresh vegetables to clients at the services center and to New Richmond School District for the backpack program. Sharon Razor is also the grandma of my daughter's best friend, because you probably wanted to know that. But I think that's what I wanted to highlight just in my comments. And as I said, I hope you had a chance to read through the entire report, and all of my administrators and supervisors from each division are here to answer any questions that you might have.
Any questions of Bob or the other departments? It's a lot to go through. Go ahead, Kathy.
I think this is a great report. I really do appreciate the pictures and seeing the faces, because I know that's what makes this department so special. So thank you. It was exceptional.
I really appreciate all the graphs and the pictures and the data. It makes the data more personal, I think. So thank you very much for all the work putting into this report.
I would just say that Colleen had the unfortunate task of putting this all together into this nice format, so
I should be looking at
she
Colleen
deserves
then.
some credit.
Thank you, Colleen.
Thank you, Colleen.
Any other questions or comments? Thank you very much. Appreciate it. Next item, resolution urging legislators to approve immediate funding for inpatient psychiatric care in western Wisconsin. This came about as of Friday when I called Heather and said we need to have something so that we can present to the WCA annual conference and to keep this fire going, to put pressure on legislatures. So everybody should have received a draft, and it's up for discussion And any color comments, and or Heather, do you have anything you want to say, or?
Yeah, so I worked on this resolution with Bob. Basically, the background information just covers the 2 acts that were recently passed that address some of the mental health services issues in Wisconsin. Act 117, which allows for DHS to request a federal waiver from federal DHHS to allow for Medicaid reimbursement for individuals that are at facilities such as Winnebago. Again, that's a process. It doesn't happen immediately, but that act does allow Wisconsin DHS to seek that waiver. And then the second act, Act 249, does authorize crisis urgent care and observation centers. It allows DHS to request a release of $10 million to start that process. Again, it's probably a lengthy process that's not going to happen immediately. So this resolution basically just sets forth some of the statistics in St. Croix County, how many times we are sending people over to Winnebago, the cost for it, and then urging the legislature to fast track and prioritize mental health funding in Western Wisconsin. And then the last request is to send this to the governor and to the legislature and to WCA and any other stakeholders that may be relevant to this request. And Bob might have additional information to add, but this was at the request of Supervisor Telejohn so that the WCA could have it by their conference in September. The deadline is late June, so by having it at this meeting, it can get to the county board at the beginning of June, so it meets the deadline.
Any comments or questions or corrections? Go ahead.
I think this is a really important statement to be made. This is tragic for our region, and the fact that we're struggling to find the funding to provide this care. I think the care that's provided by our county services is tremendous, but it's not going to be enough. This is such a huge loss. So thank you. This is a great draft, and I appreciate the opportunity to send it forward. So.
I move to approve the resolution.
Second.
Looking at you first.
I'll second that.
Motion's been made and seconded to approve this resolution as presented. Any other discussion? Okay, I thought we'd have more discussion. Okay, great. I think we all realize that we need this now. So all in favor, say aye.
Aye.
Motion passes. Thank you, everyone. And thank you, Heather, for your quick work. Requests for future agenda items. Any requests? Okay. Announcements or correspondence? Any announcements or anything? Bob?
I was just going to mention that we did have our annual symposium at St. Croix Central High School on May 1st, and that's recorded and on the website if you get a chance to maybe watch that sometime. I thought it turned out very well. I thought the speakers were excellent. The young people that volunteered to take part in the panel discussion were really outstanding. And then we had our peer specialists do a little video. Well, Adam did a video with them that was really it'll be worth your time to watch. It's separate on the website. It takes 8 minutes. But I wanted to just thank those that were involved with that.
Any other announcements? Date of the next meeting is June 19th at 5 p.m. back here. Same place, same time. I'll adjourn the meeting at 5:54.